BPC 157 is a powerful healing peptide that's found in the gastric juices, and it stands for body protection complex. And what's so unique about this peptide is,
and getting into these peptides, we hear about the anti-inflammation, we hear about the tissue regeneration, we hear about the angiogenesis, the growth and branching out of new blood vessels. So what are the most popular healing peptides that we have? And talk about a little bit of their mechanisms of action and how do they actually work in the body?
fasting, believe it or not, is extremely healing. This is our centerpiece for our lasting weight loss program, but fasting for 48 hours, say every single week, is really going to turn on some powerful cellular autophagy, internal healing processes, reducing your stress load if you can, reorganizing it, or implementing a stress management technique, adding some powerful adaptogenic herbs. And people don't realize the injury itself is a stressor. So one supplement that I always recommend to people if they are dealing with an injury is
I've been so excited to jump into this topic with you today because it seems like anyone who's tried to maintain a lifestyle of health has always been met with this double-edged sword. The more active you are, the more prone you are to injury. And if you get
yeah.
hurt, treatments are so dramatic, right? And, 10, 12, 15 years ago, we had the stem cell boom. And rightly so, there was a lot of trepidation, there was a lot of fear, a lot of conflict. It was causing tumors. We were using embryonic cells. Then we did have the non-embryonic allograft stem cell, but by that point, there had been so much smearing and so much negative attention that it never really got a chance, if I could say it like that.
Yeah.
Um, and then lo and behold, peptides come out, and we hear about BPC, TB500, a couple others that we'll talk about today. And it just seems like there's an entirely new universe and a new way to safely unlock some new aspects of health and try to avoid some of the more dramatic and invasive procedures. So starting with BPC, I know we covered peptides in general last time we met, but just as a brief overview, let's just go into what is a peptide.
Yeah, we'll do a quick recap. And if any of you listeners, check out the last podcast we did or my Peptide 101 video is great on our YouTube channel. But essentially, I always tell people to think about peptides like hormones and what they are. A hormone is released by a certain part of your body. They're produced in glands. The hormones are floating around the bloodstream and they activate, they turn on various processes in the body on other tissues, other organs, other systems. It's a very systemic effect, right? And every hormone's different and there's different receptor sites. You can think of peptides